So the first part of the assessment, once you've done the consultation and got all the information, is to look at the posture. So you're going to get the patient to stand up, and all you're looking from the back is you're going to look at the ear level, shoulder level, level of the scapular border. Then you're going to look at the iliac crest, and then you can look even further down at normally the feet. So what you're looking for is a foot posture where they're overpronating, whether there's bowing of the Achilles. And as you can see, if you relax there first, you can see how it drops in there. There's a little bit of bowing, not too much, but you can see there's not much space underneath the arch of the foot. And you can see if I replace that foot there, good, that's a better posture. Now if you relax for me, you can see how everything drops in and the knee rotates in. So that's one aspect you want to be looking at, and it's happening on both sides. Looking at, like I said, level of the iliac crest, see if there's any hip hiking. Looking at the base of the scapula and the shoulders to see if there's any change in alignment of the shoulders there, and also the ears. Then you want to look at the posture from the side. So what you're looking from the side is the position of the ears compared to the shoulders, how far forward the ears are from the line in regards to the shoulders there, how much curvature is in the lower back, do they have an increased anterior pelvic tilt? Do they have a flat back, or is it more of a posterior pelvic tilt? And you can see with Kate here is a bit more of a lumbar curve with a slight increase in the anterior pelvic tilt going on there. Fantastic. You're also looking if they're hyperextending their knees, and obviously foot position as well, whether the feet are turned out straight or pointing inwards. From the front, again, you're just looking at shoulder height, looking at the feet, knees. So on Kate, you can actually see, especially on the right knee, that the knee is pointed inwards rather than tracking directly over the big toe. So if you come up with your foot there, and you can see now that alignment, knee is pointing directly over the big toe. So that's a better alignment there. So those are the little things you're trying to look at. But also with regards to the shoulders, how much of a forward rounded shoulders they have, a good way to tell is to look at the hands. And the more knuckles you can see, the more internally rotated the shoulders are. So you should only be able to see like the thumb and the first finger, whereas with Kate, you can just about see three fingers, three knuckles on each hand. So there is a little bit of internal rotation. It's not terrible, but there definitely is a little bit of rounding that you want to focus on there. So once you've done the postural analysis, we then just want to assess some movement. So we're going to look at cervical range of movement. So you can look over your right shoulder for me. And you're going to look over the left shoulder. Good, look straight ahead. Drop your right ear to your right shoulder. Left ear to left shoulder. Great. Look straight ahead, look up towards the ceiling as far back as you can go. Good. And look straight ahead and drop your chin to your chest. Good. So you're looking for the full range of the shoulder, of the neck, but you're also looking for if it's a uniform movement as well, not just at one specific level, while there's uniform flexion or extension or rotation. Then we're going to look at the range of movement of the shoulders. So you're going to bring the arms up in front, all the way up to the ceiling. Just you want to compare side to side if they have full flexion of the shoulders. And you're also looking for what's happening with the scapula as well. So take those up again, all the way up. Good, and back down. And then bring your arms out the sides all the way up for me as well. And again, you're looking for, is there any pain, restricted movement? Is there any stop-start? Is there any dysfunctional movement? You also want to note what happens with the scapula. Obviously, it's better to see it when they're wearing a vest or if they're in a gown, because you can actually see some skin and see what's happening with the scapular border. But you're looking for, is there any winging and so forth through the shoulder blades. You then want to maybe look at basically the shoulder internal rotation and external rotation, but in a function pattern. So you bring the arm over the top and just touch the shoulder for me there. Good, and come back out of that and repeat. So you're looking like for if they can actually achieve that movement and back out. And is there any compensatory patterns? And if you do the same on this side. Good. And you want to compare side to side. And this time bring this arm behind your back up into the bottom of the scapula there. Good. And you're just looking for the obviously range of movement. And is there any compensation? Are they trying to tweak the wrist to achieve that movement? And that's quite comfortable. Come out of that again. Good. And this side. And you also want to see if it's a fluid motion. So do that once more for me. And you can see she kind of dumps into that position. So although Kate can actually achieve that position. If you watch her shoulder as you do that again for me. That was a little bit better, but she has a lot of compensation going on up here. Good. Looking at the lower back, we then want to get Kate to bend forward and touch her toes. So one, looking at range of movement, also looking for any pain, but you also want to see where the bending comes from, okay? Whether there's a flat back, whether they're bending higher up or lower down. This looks pretty good going on there, and come back up for me. Good, and you also want to see if they're hinging from a certain level as they come back up. Now, if you extend as far back as you can go. Good, and relax there. Obviously, you can see Kate is very good at that. Slide this hand on the right leg. Side bending, and left. Good. And then just pop your hands across your chest for me. And then all I want you to do is rotate as far back and try and look at me this side. So go round to the left and rotate. Good. Now, one thing I want you to try and do, just keep that there. Try not to lean, just rotate. Good. And now the other side. So look where you're going as well. So bring your head around and then rotate. Good, okay. And you can actually see she's a little bit restricted throughout the thoracic. So although she's quite mobile, this movement, look over the shoulder, with actually a little bit of help, that's a little bit better. Okay, good. And relax there. Then the last thing we want to look at is, we talked about foot posture, but we actually want to look at proprioception and stability. So if I can get you to stand up on your left foot for me, then you want to see what happens at the hips, where there's any drop or hike in the hips. You also want to see how well they balance and if they collapse in on the arch. And actually, on one foot, Kate's a little bit better. Her stability is quite good there when she gets set. So you also want to see how long they can stand in that position without falling over. So stand on your right foot for me. Good, that's much better. Perfect, and relax there. So once you've done those range of movement tests, there's a couple of extra little tests that I do that I'm going to run through. But it's a quick screen on posture and range of movement. So one of the tests I do is just bring your arm out to the side here, look straight ahead for me, push this hand up into my hand there. Good, relax there. Bring your left hand behind your back. Can I borrow your thumb for a second? Just want to place her thumb onto the PSIS. Bring that up there. Now push up into my hand there. And you're looking for any weakness when there's contact on the SI joint. And then you want to take your index finger. Can I borrow your index finger? And you're just going to place it just in there. Bring your arm out to the side and push up into my hand there as well. Perfect, nice and strong. So what we're just looking at for is a little bit of SOT where the Kate's shoulder strong when I first test it. If then by placing any contact on the SI joint or posterior aspect of the mastoid, if there's any weakness, it could signify SI being a category 2, so an SI kind of dysfunction, any rotation or instability in the SI joints. Higher up, so that would more indicative of potential of being a disc. So then in themselves, that won't tell you that's what it is, but it gives you a good idea. Okay, let's go and address that and look into that a little bit more. Cool. Just to recap then, so once you've done your consult, get the patient up, you're going to do a postural analysis first, looking from the back, side and front. Once you've completed that, you're then going to do some range of movement assessments. So looking at the neck, the shoulders, lower back and hips. And then we want to look at postural, foot posture, but postural balance as well. So getting the patient to stand up on one leg and addressing any of those issues that crop up there. And then you can do a little bit of muscle testing as well in this position to kind of guide your assessment. So the second part of the assessment, you're going to get the patient to sit down. When they're not thinking about it, just have a little quick look at their posture, because when they're not thinking about it, when they think about it or know you're looking, they're going to try and correct themselves. But when they're unguarded, you might see how they actually do sit when they're at home or at work, for example. So at the moment, Kate's sat in a quite good posture, but you might find they actually slump or even lean backwards. So you might find where they hinge from is where they get most of their tension and discomfort. So that'll help with any advice you're going to give them to help along, in their lifestyle. So once you've had a quick look at their posture, You're then going to go through your myotomes, dermatomes, and deep tendon reflexes. You should probably do this on most patients because it gives you a good baseline, and it covers a lot of areas that you just want to get out of the way and ticked off, even if they're not suffering with any radiculopathy. I'm not going to go through those right now because you should know how to do those. But yeah, so you're going to do your myotomes, dermatomes, and deep tendon reflexes. While it's seated, you can also do the cervical range of movement and shoulder range of movement, but I've already done that standing, but you can do. If indicated, you might want to do cervical compression or distraction. You might also want to do, if there's an upper body complaint, you might want to do some muscle testing on the upper body, and I'll go through that in a separate video. If they've got a lower back complaint, then you might want to do a slumps test to give you a better indication of what's kind of going on, where the neural tension is. So to demonstrate that case, just going to slump forward for me. Good. You're going to straighten the left leg. That feel okay? Mm-hmm. Fantastic. Relax there. Straighten that leg for me. Feel okay there? Mm-hmm. Fantastic. Good. So you sit nice and tall for me. So they usually will feel some tightness in the lower back or hamstring. They might even feel a little bit more discomfort in the lower back. But a positive test is if they feel sharp or shooting pain down the leg, and then that's maybe more indicative of like a disc derangement of some sort. So it's just going to help lead your assessment a little bit further. So the third part of the assessment, you're going to have the patient lying supine. I always start at the bottom end of the table, start off looking at leg length, and then work our way up. Okay, so it kind of follows a flow, and you want to try and do the assessment so that you do everything while they're supine. Then you can get them turned over onto prone and do everything in that position, and then you can do side lying. So you're not getting the patient to turn over all the time. So it's a little bit more flow. So standing, seated, lying on the back, lying on the front, lying on the side, then you're done and you can go and you can present your findings. So looking at leg length, just going to give them a little bit of pull first, and then just check the calcaneus. Looking at the level of the malleoli, then you can bend both knees for me. Put your feet together, just try and make sure everything's leveled out, and just eyeball it. We're not going to measure with measuring tapes or anything at the moment, but you're just looking at the height of the knees, but also the tibia. So you're trying to look at if there's any unleveling going on in the front of the knees here, which might indicate an increase in the femur length, or if the height of the knees is different from side to side, it might indicate greater growth of the tibia. At the moment, case not too bad. There is a slight difference, but you're not going to have everyone perfectly symmetrical. So you just want to make sure that the feet are nice and level there as well. So what you're trying to look at, is it more of a functional leg length, or is it more of a structural? And if you want, you can take that a step further and start doing the measurements, but it's quite good to just quickly eyeball it in supine, and then when you're prone, you can do it again. Just relax legs down there. Perfect. So now we're going to do a straight leg raise. So bring your legs nice straight up there. Good. Just test it then. Possibly feel okay. Mm-hmm. Just trying to feel where the bind is. Bend the knee. You're just going to test the hip mobility. Internal rotation, external rotation. You can actually see Kate's quite mobile through the hips here. Fabers. A little bit of down pressure on the ASIS and on the knee. How's that feel?
All right.
Bit of a stretch. A little bit tight in through that position. You're going to do the same on the opposite side. Nice straight leg, all the way up. Good. Good. Bend the knee. So in this position, you're kind of seeing if there's any pain on any particular, in any positions, but you're also looking to see if there's any asymmetry from side to side. And obviously all the time asking, how's that feel? Is there any discomfort? And then tying that, obviously any discomfort or lack of range of movement together, see if that has something to do with the issues. So just done a quick screen of range of movement. Now we're going to do a little bit of muscle testing. So I'm going to keep the leg nice and straight for me. Hold it there for me. Good. Now I want you to push up into my hand. So you match it and then just a little bit over pressure, seeing how quickly those muscles kick in. Out the side, push. Perfect. Good. Bring it back up. Turn your foot in. You're going to go to that corner of the room. Push up for me. Fantastic. Turn it this way. You're going to go up that way for me as well. That's not too bad. And then you're going to push in for me. Push in nice and strong. Good. So in that, we were looking at hip flexion. Then we were looking at abduction. We had adduction. Then we were looking at TFL. And we were looking at psoas going that way. Okay. Same on this side. So hip flexion, push up in my hand, meet it, and then overpower a little bit. Good. Push out to the side. Good. Push in for me. Fantastic. Turn your foot in. You're going to push up that way. Good. And that way. Good. You can also test QLs. So grab both feet together, hand underneath. So I'm going to try and pull you. You're going to hold your legs out there, okay? So hold. Good. On the other side then, so you're just going to take your legs over that side. Hold it dead on a pull, okay? Nice and strong. Perfect. So once you've done your lower body screen, you then want to go and check the neck and upper body. So in this position, let's just change this a little bit for you. Cervical palpation. I'm not going to go through this too much. You should know how to do this. Once you've done the cervical palpation, you may want to do cervical range of movement while lying to see if it's more of a postural issue when they're stood up compared to when they're lying. So if they've got decreased range of movement when they're stood up, but when they lie down, they got full range of movement, then it's likely that it's actually a postural issue rather than an actual mobility issue. Drop this down. Check shoulder range of movement lying down, so bring your arms all the way back this way for me. Great, that's perfect. So what you're looking at here is how far the hands go back, but whether there's a difference from side to side. But you're also looking for example, if this arm was up here, you're probably looking more at like this tightness in the pec. Or if there's some bending going on, you're looking at more tightness in the lats. But actually, in this position, Kate's pretty good. But as you know, she's got quite an increase in mobility throughout. Good. Relax those arms there for me. External rotation. Internal rotation. Just keep an eye on the shoulder as you bring it forward there. You can see she kind of dumps through. Good. Check the other side. Any pain on any of those? No. Fine. So that's a good quick screen of shoulder mobility. You can also sit down behind and actually look at the shoulders. And I gather you're right-handed, because you'll normally find on the more dominant hand slight more internal rotation on the shoulder, because you tend to use that side a lot more. And you can actually see, we just measure from the bench up to the shoulder, and you can actually see where there's internal rotation of the shoulder. Left side's not too bad, but there could be a little bit of improvement. Right side, you can actually see there's a little bit more lift. So obviously you're looking to try and drop that down a little bit there. So a little bit of that tightness in the pecs and internal rotation. Once you've done that, you want to do some muscle testing. So I like to do some AK kind of muscle testing. So for cervical, I would use a big muscle to start off with, like with the leg. Okay, so hold that there for me. Remember, these were strong before. Push up in my hand as hard as you can. Good. Now look over your left shoulder for me. And push up again, push. You can't hold that, push up. Okay, good. And look over your right shoulder and push up again for me. That's better, good, do that again. So right, push up, good. Look over your left, push up. And I don't even have to try. So obviously we're thinking there's something going on at the upper cervicals. So you can also do side bending. So bring your head to the side, lift this up for me. Push up again for me there. That's good, do that again. Good, side bend to the other side. So try and look, keep your nose up towards the ceiling, just side bend, that's it, push up again. Good, so just do the left side again for me. So rotation, yeah, push up, nothing. Just side bend, no rotation. To the left. Yes, please, good. Now push up, stronger. So you're really looking at C0, C1 on the left side. That's the likelihood there's something going on there. Obviously, don't just use one test. You go in, do your palpation, do your other tests to figure that out. But it's a good screen, a quick screen to see what's going on there. Then we're going to go, turn around there. You're going to push across. So keep your arm locked out for me. That's it, good. Now push across there. Good, C4, C5, C6, C7. Okay, and do the same on the other side. Put it in, C4, C5, C6, C7. So again there you're looking at doing a little bit of quick screen muscle testing, and you can combine that with your palpation of the cervical spine and try and tie in, does that make sense to what you found with feeling the spine but also your muscle testing. So the fourth part of the assessment is with the patient prone. So again, just going to check the leg length. So just give it a little bit of a pull to level things out. Let's have a little look. So those are nice and level. Then you want to bend the knees and keep an eye if there's any changes. So what you're possibly looking at, if there's a difference with a straight leg, then you might be thinking is the more of the SI, so the ilium side. But if there's level and then you bend the leg and there's a change, then you're probably looking more sacral base side. Okay, so that's a good indication there as well. But Kate is looking fine there. You also want to look at flexibility in the quads. So you just want to do a bit of knee flexion. Good. External rotation. And compare side to side. So yeah. So bend both knees, drop both legs out to the side. Good. Then what I want to see is just lift this leg up nice and straight for me. Good. So what you're trying to look at is the range of movement of hip extension, but how much of involvement in the lumbar spine, and actually look higher up as well if there's a compensatory pattern higher up. So lift this leg up for me. Not too bad, but you do see a bit of a lift in that shoulder. Relax that down for me. Lift this leg up for me. Good, and there's a bit of dropping through the lumbar spine here as well. Then you just want to have a little feel through the movement to see what the firing pattern. So hamstring, glute, so lift that side up for me. See which muscle's kicking in first. Relax down there. Lower back, hamstring, and again. And down. Glute and lower back. Good, and relax there. And you're going to do the same on the opposite side. So what you're looking for is glute and hamstring that kick in roughly around the same time, then lower back on the contralateral side, then ipsilateral side. What you tend to find quite often is the lower back kicks in first, then hamstring, and the glute is the last, the join in, which is going on slightly here as well. So you'll tend to find a lot more compression going on in the lumbar spine, a little bit more rotation through the lumbar spine as well. You also want to have a little compression through the SI joints. So just having a feel if there's any hyper or hypo mobility. You also want to have a little bit of compression through the lumbar spine. So is any discomfort? If I press down through here, any discomfort? No. No? Good. If there was, I would then ask Kate to pop your hands behind your head. Lift your chest off the bench. Good. And then retest. So compress the lumbar spine. And if, relax down there was a decrease in discomfort, then you're probably thinking more of a facet issue, so a bit of instability. And when you get the kind of compression through the tightness in the muscles, it actually provides a little bit more stability and it feels better. So once you've done that, we then want to do a little bit of muscle testing. So bend this knee for me and just push into my hand, meet it and then overpower. Good, that's hamstrings. Bend this side, push into my hand. Fantastic, nice strong there. Lift the whole leg up for me. Good, now push up in my hand and hold it there. Good, this side, push up my hand. Good. It's important to note with the muscle testing, you're not trying to overpower them. So what you're trying to do is they're going to push up into you, you're going to meet it, and then you're going to do a quick increase in pressure and just see if that muscle can meet that demand, okay? And then we're going to do a lumbar spine. So lift this leg up, bring it all the way across, hold it there for me, and I'm going to try and push down now. So hold it there. That's nice, good. And this side. And hold it there. Fantastic, good. And then you do your usual palpation of the spine and the muscles to see where the tension is, where's discomfort, what's restricted, what's mobile, to complete obviously your assessment in prone. And then you'll move on to the last part of the assessment, which is side lying. So have a lie on your side for me, facing that way for us. So last little bit, you can keep the bottom leg bent, but your top leg, I want you to straighten out. Just place it there for me, good. So from here, what I want you to do is just lift that leg up towards the ceiling for me. So what you're trying to look for is some compensation, okay? So in Kate, you can see automatically she's rotated her pelvis backwards. She's brought in more the TFL rather than the glute medium minimus. There's also a little bit of external rotation of the foot. So what we're trying to do is bring your leg straight, keep your foot horizontal, okay? And I just want you to lift through this position, okay? So already that's told me there's compensation patterns going on, so there's a bit more tightness in the front of the hip, and there's going to be a lack of strength and activation within the glute complex. So in that position, now bring it up nice and. Did you see how, as well, how the leg drifted forward rather than staying back? So there's more overactivity of the anterior compartment compared to the posterior compartment. So bring that down, bring it back to the side, and do that again for me. Good, a little bit better, but again, pelvic rotation, so you want to try and stabilize that. So in this position, now what I want you to do is push up in my hand as hard as you can, push, 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 and there's no strength there, okay? So don't let them compensate, so try and push up in my hand. You can see already nice and strong, but the pelvis is rotated backwards, so forward there, hold up there, now push up in my hand, and there's nothing going on there. Okay, just try it once more. Push up in my hand, push, push, and I don't have to try very hard, okay? So you can see there's some weakness in the lateral hip stabilizers. So that's one test, but also you can look at the firing pattern where the glutes are kicking in, or the QL, which is there any hip hiking going on and so forth as well. And then once you've done that, the last test I tend to finish with is the modified Thomas test. So have a stand up for me. So you're going to sit on the end of the bench for me. Put this up higher. Try and shuffle down right to the end a little bit. That's great, cool. Good. Now what I want you to do is hug this knee to your chest. Good, I'm going to hold you, I'm going to help you, and you're going to lie back, okay? Good, comfortable there. Just relax this leg for me. Is that relaxed? Yeah? So what you're trying to look for is any tightness in the anterior compartment. So one, how high is the knee? So the knee should be below the hip. And you can see obviously it's off the bench there. So if I just, the knee should be all the way down here. So that's going to show that you've got tightness within the hip flexors, whether that's the TFL, psoas, but also you can see in the rec fem and the quads, because this leg should drop to 90 quite comfortably. There's natural extension going on through the knee. So there's tightness in the front part of the leg, the quads. But you're also trying to look at where the leg drops. So is it straight or is it going out to the side? Going out to the side shows a bit more tightness in the TFL. And actually, so we've got tightness in all those complexes at the moment. So that's maybe partly why Kate, when she stood, had a bit more of an anterior pelvic tilt, slightly increasing the curve in the lower back. Just hold my hand and come all the way up. I'm just going to test the other side. So hug that knee for me, roll back. Good. And again, you can see now, so from behind, you can see how the knee goes out to the side. You can see how the knee's extended, and you can see that the knee is quite high off the bench. So again, same from side to side, so those issues. There you go, just hold my hand. So when a patient comes with an upper body complaint, then you don't have to do the full spine examination. We can mainly look at what's happening in the upper body. But I do recommend that actually, if you have time, do some of the screening on the lower body, because if there's any pelvic unleveling, if there's any glute weakness, for example, it will cause issues higher up into the shoulders. So I would definitely be looking at leg length, pelvic positioning. I would definitely be looking at the strength of the glute complex, because, for example, if the left glute isn't firing correctly, then you might find compensation on the right upper trap, right shoulder region. So I would definitely assess those. But in today's video, I'm just going to quickly run through how you screen for the upper body. So like the previous video on the full spine assessment, you will have the patient stood up, you will do the postural assessment. You'll also need to rule out any issues with the cervical spine, because if it is a shoulder issue, for example, or upper back issue, you want to make sure that there's no issues arising from the cervical spine, whether that's a disc issue or so forth. So definitely screen the cervical spine as well. So when they stood up, look at the cervical range of movement, look at the shoulder range of movement like we went through before, look at the postural alignment of the upper body. Then when you get in a seated position, you can go in and be a bit more specific with your assessment. So looking at the cervical spine, looking at range of movement, you can do some compression just to rule out any issues there. So compression straight down, then to the side. Any pain on those?
No.
No. That's fine. If they have any radiculopathy, then you might want to do a cervical distraction, see if that relieves any of the symptoms. In this position, you can also do range of movement of the shoulders, but I normally do it when they stood up. And then you can do some specific tests for the shoulders. So, a couple of tests you can do to check for impingement. Pop your hand on the shoulder there. Bring that elbow up towards the ceiling for me. Any pain there? No, fine. Good. Just relax this arm here. So I'm just going to rotate your arm inwards. Feel okay? So let's just do that again for me. So hold that. Feel okay there? No impingement going on there. Good. Take the arm across. Feel okay there? Turn your thumb down. Then you're going to push up into my hand. Good. Turn it out that way. Now push up again. Any discomfort going through there?
No.
Those last two tests are looking more of a labral tear. So you're just looking at some impingement issues, looking at any labral tears going on. You want to do some gentle muscle testing as well to look for any tears or inflammation of the tendons and muscles. So for example, push up this side there. Good. Bring it down for the supraspinatus. Push out into my hand there. Good. Bring it forward. You're going to push up in my hand. And again, all these muscle tests, you're not trying to overpower. You're going to try and meet the resistance and then just a slight increase in intention, see if they can match that. So for example, just push up in my hand. Good. Turn your hand over, push up in my hand there. Good. Bring out the side, thumb down, and again, push up in my hand there. Good. So again, that's supraspinatus, and then we're going to look for your serratus anterior. So hold up there, push up in my hand for me. Do that again for me. Push, push. That's not too bad. It felt a little bit weak at the first time. So just going to run through those muscle tests again. So from here, push up the side. Supraspinatus, push up, delt, push up for me, delt, push up, bicep and delt, push up there for me, supraspin, serratus anterior, push up there. Good. So if you found weakness on this one, so pretend you're weak and it goes down there, it's usually an indication that the serratus anterior is not firing properly. So it means that there's going to be a lack of stability within the scapula, which then is going to cause issues with the function of the shoulder. So that's a really big test there. If that is weak, a good way to test it, so if you push up the hand there and it's weak, a good way to test that is trying to wake up the serratus anterior. So you can actually, I'm going to tickle you now, okay? So you're going to pop the arm across, get into on the ribs and just rub. Good. So that's going to kind of just 5 to 10 seconds just to warm those muscles up, wake them up. Relax your arm there for me. Retest, so push up in my hand, and it should be nice and strong. That's good indication that the serratus anterior is having a hard time activating, which then is going to cause stability issues with the shoulder. So you want to target that area in your rehab. Okay? So those are some of the muscle tests you do with the shoulder. Obviously stood up, you're going to do the range of movement. You can do your special tests, which I've run through a couple of them, looking for any shoulder impingements, labral tears. You also want to look at any thoracic outlet issues as well. So you got your TOS test as well, which I'll show in another video, but they're all your special tests for specific conditions to rule those out. Then you're going to do some what we did before, so upper scratch test, so where you bring your arms over your shoulder and behind your back. I also like to do a lift off test, so bring your hand behind your back there for me, and just ask the patient to lift your hand away from your back. Perfect, good. And then do the same but push into my hand. So you're also looking for a little bit of strength there. And you're going to compare that side to side. Good. Lift that off. Perfect, good. And push against my hand. So this is the teres, just testing the function of the teres muscle. So the second part of the assessment, so once you've done the patient's seated, get them lie on their back, and like we did on the full spine examination, you're going to look at cervical range of movement, cervical palpation, but also then shoulder range of movement. So bring your arms over the head, so bring them all the way up here, good. Just check, straighten your fingers for me. Just check that there's nice and level. Check in from side to side if there's any difference into full flexion. So you're looking if there's any tightness within the pecs, or if there's any bend in the elbows where there's tightness in the lats. You then want to look at internal and external rotation of the shoulder, comparing from side to side, see if there's any asymmetry. You can relax the arm down. Now, one thing to note, obviously with Kate, that's not too bad, but say they did go a little bit further, then you're thinking actually they're hypermobile in the external rotation, but you want to look at the full arc. So if they decreased in internal rotation, but slightly increased in external rotation, they have a normal arc. But for example, with Kate, you know, she's got quite a pretty good internal rotation, and external rotation is bordering on slight excess. So you could think she's got a slight hypermobility in the shoulder. And then you do the same on the opposite side. So you're looking at whether they've got tightness in the pecs, whether they've got tightness in the subscap or lats. Also, if there's any restriction in the posterior aspect or the delt, but the infraspinatus, teres, and so forth.